Today, we're talking about Pnv Cmb #21 Iron-Folic acid tablet. This medication is a multivitamin and iron product that is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important building blocks of the body and help keep you in good health. It's important to take this medication as directed by your doctor. Typically, the recommended dosage is once a day, and it's best to take it with a meal to help with absorption. Remember to follow your doctor's instructions and consult with them if you have any concerns about the timing or dosage of this medication. When taking Pnv Cmb #21 Iron-Folic acid tablet, it's best to take it by mouth, usually once a day or as directed by your doctor. Make sure to follow all the directions on the product package and not to exceed the recommended dosage. If you have any questions, it's important to ask your doctor or pharmacist. For the best results, take this medication on an empty stomach, either 1 hour before or 2 hours after meals, and with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. After taking the tablets or capsules, make sure not to lie down for at least 10 minutes. If you have any questions about your particular brand, it's best to consult your doctor or pharmacist. If you are taking the delayed-release form or extended-release capsules, make sure to swallow them whole and not to crush or chew them, as this may increase the risk of side effects and decrease absorption. Only split extended-release tablets if they have a score line and your doctor or pharmacist instructs you to do so. It's important to take this medication regularly at the same time each day to get the most benefit from it. Some common side effects of Pnv Cmb #21 Iron-Folic acid tablet include constipation, diarrhea, or upset stomach, but these are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist. Iron in this medication may cause your stools to turn black, which is not harmful. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. It's important to talk to your doctor about the best time to take this medication and the recommended daily dosage. If you experience any side effects, contact your healthcare provider for medical advice. It's important to keep Pnv Cmb #21 Iron-Folic acid tablet out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. In case of an overdose, it's crucial to seek medical help immediately or contact a poison control center. Before taking Pnv Cmb #21 Iron-Folic acid tablet, it's important to inform your doctor or pharmacist about any allergies you may have, as well as any medical history, such as iron overload disorder, alcohol use, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it. It's important to inform your doctor about all the products you use before having surgery. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking Pnv Cmb #21 Iron-Folic acid tablet, it's important to be aware of potential interactions with other medications. This product can decrease the absorption of certain drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as much as possible from your doses of Pnv Cmb #21 Iron-Folic acid tablet. Make sure to consult your doctor or pharmacist for guidance on how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs, as the combination may have an effect. Additionally, this medication may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this medication. If you or someone else has taken too much Pnv Cmb 21 Iron-Folic acid tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222. For Canadian residents, contact your provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to seek help if you suspect an overdose. If your doctor has prescribed Pnv Cmb 21 Iron-Folic acid tablet, it's important not to share it with others. Make sure to keep all medical and lab appointments as directed. Some brands of this medication may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that this product is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you are taking Pnv Cmb 21 Iron-Folic acid tablet on a prescribed schedule and happen to miss a dose, you should take it as soon as you remember. If it is close to the time for your next dose, then you can just skip the missed dose and take the next one at the regular time. It's important not to take a double dose to make up for the missed one. When it comes to storing Pnv Cmb 21 Iron-Folic acid tablet, make sure to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. Remember to always handle medications with care and follow the proper guidelines for storage and disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.